Child welfare policy in the United States: history, challenges, and future directions. This presentation examines the development of child welfare policy in the United States, including its historical foundations, major federal legislation, current challenges, and possible future directions for reform. Child welfare policy shapes how services are delivered to vulnerable children and families, making them a critical component of the child welfare system. The child welfare system is a network of public agencies, nonprofit organizations, and courts that work together to protect children from abuse and neglect while also supporting families. As described by the Child Protection Global Network, the system focuses on keeping children safe while also providing services to families who may need support. So what is the purpose of the child welfare system? The purpose of the child welfare system is both protective and preventative. Agencies investigate reports of abuse or neglect and provide services such as family support programs, counseling, and even foster care placements when necessary in order to ensure the safety of children. So who is served? The system serves children who may be experiencing abuse, neglect, or unsafe living conditions, as well as families who may need assistance in creating stable environments for their children. Why does policy matter? Policy is an important part of the child welfare system because it guides how that system operates. Federal child welfare policy focuses on three main goals: ensuring children's safety, achieving permanency for children through reunification or adoption, and promoting the well-being of children and families. Historical foundation of child welfare. We're going to take a look at earlier movements when child welfare was just beginning. In 1854, the orphan train movement took place and was organized by Charles Brace through the Children's Aid Society. The program aimed to address the growing number of orphaned and homeless children that were living in overcrowded cities in the eastern United States. These children were transported by train to rural communities in the Midwest, where they were placed with families who agreed to take them in. During this time, approximately 200,000 children were relocated. While some children did find stable homes, others experienced difficult conditions, highlighting the early challenges in the child welfare practice. During this time, early reform efforts also emerged. The charity organization societies worked to organize charitable services and provide structured assistance to families that were experiencing poverty. The COS movement developed in the late 1800s in response to the growing poverty caused by urbanization, industrialization, and economic depression. As the cities grew, many charities operated independently and insufficiently, often providing duplicate or unregulated aid. COS leaders believed that charities should be more organized and scientific, using investigation, record keeping, and coordination between agencies before assistance was given. They introduced systems like centralized registries and friendly visitors who work directly with families to encourage values such as working hard and self-sufficiency. This movement aimed to reduce poverty, prevent fraud and duplicate aid, and also create cooperation among charitable organizations. These practices later influenced modern social work, particularly the development of casework and professional social service systems. Another movement was the child-saving movement. The child-saving movement changed how society responded to delinquent youths by shifting the focus from punishment to rehabilitation. Reformers believed that most young people could be saved, and they created juvenile courts and special correctional institutions to address delinquency. However, these reforms also expanded government control over children's lives, particularly targeting lower-class youth. Although the movement promoted rehabilitation, many institutions still use strict and coercive practices. Middle-class women played a significant role in leading these reforms, advocating for moral guidance and protection over traditional family values. Overall, the movement highlighted the difference between the ideal goals of reform and the reality of how those reforms were implemented. Federal involvement in child welfare begins. Federal involvement in child welfare really started with the Social Security Act of 1935. This law created Aid to Dependent Children. Aid to Dependent Children provided financial assistance to families where children did not have parental support. Prior to this, most child welfare services were handled locally or by charities. This act marked a major shift because it involved federal funding to support vulnerable children and families. This went on to lay the groundwork for child welfare policies that came after. I want to highlight some more policies that were implemented throughout the years of child welfare. Child Abuse Prevention and Treatment Act, or CAPTA, of 1974. CAPTA was passed and was the first major federal law that focused on child abuse and neglect. CAPTA provided federal funding to states to help develop child protection systems, including mandatory reporting laws and investigation proceedings. This law set the standard for how child abuse cases are handled. Before CAPTA, there was little national coordination on how child abuse cases were identified or even addressed. CAPTA provided federal funding to states to improve child protection service systems, including procedures for reporting and investigating abuse. One key part of this law was the establishment of mandated reporting, requiring professionals like teachers, doctors, and social workers to report suspected abuse or neglect. This law supports research, training, and prevention programs that help strengthen the child protection system across the country. Continuing with federal laws, the Adoption Assistance and Child Welfare Act of 1980. This law shifted the focus toward keeping families together whenever possible. Child welfare agencies must create written case plans within 60 days of a child entering the foster care system. These plans are developed with parents when possible, outlining placement in the least restrictive setting, services for reunification, and steps toward permanent placement such as adoption if reunification is not possible. This act requires child welfare agencies to make reasonable efforts to prevent the removal of children from their homes. It also provides financial assistance for those that are adopting children with special needs. Moving on with another important act or law that was passed. The Adoption and Safe Families Act of 1997 was created to improve outcomes for children in foster care. This law changed the focus on child welfare policy in order to prioritize the overall well-being of the child. One of its main goals was to prioritize child safety in all decisions that are made by the child welfare system. This law was also introducing clear timelines for permanency so that children would not linger in foster care without a stable placement. The Adoption and Safe Families Act also established termination of parental rights timelines, requiring states begin proceedings if a child has been in foster care for 15 out of the last 22 months, with certain expectations. The goal was to help children achieve permanency more quickly. Since this act was passed, adoption rates from foster care have increased and many children are reaching permanency faster, although implementation varies across states and policy continues to be debated. One of the last laws I would like to address is the Indian Child Welfare Act that was passed in 1978, also known as ICWA. ICWA was passed in order to address the high number of Native American children that were being removed from their families and placed in non-Native homes. This law created federal standards for child custody cases involving Native American children, and it prioritized keeping children with their families, extended families, or within their tribal communities whenever possible. It also recognizes the authority of the tribal courts in many child welfare cases and allows the tribes to intervene in state court proceedings. ICWA helps protect Native American families, preserving tribal culture, and ensuring tribes have a voice in decisions made involving their children. Now that we are familiar with the child welfare system and the laws surrounding the system, I'd like to go on to discuss major issues in child welfare today. Although the system is designed to protect children and support families, it faces several ongoing challenges. One major issue is the complexity of the system itself. Policies, procedures, and definitions of neglect vary widely across states and even counties, which often leads to inconsistent decision making. In addition, many caseworkers carry very high caseloads and have limited resources, which impact the quality and timeliness of services provided to families. As a caseworker, I know this all too well. There are also concerns about equality within the child welfare system. Research has shown that minority and low-income families are often disproportionately represented in the child welfare system and foster care placements. In some cases, conditions related to poverty, such as inadequate housing or lacks of resources, may be interpreted as neglect rather than a need for supportive services. These challenges have significant impacts on children and families. Children in foster care may experience multiple placements, which can lead to disruption in stability and relationships. At the same time, families involved in the system also face emotional stress while trying to navigate such a complex legal and social service system. Addressing these challenges is important for improving the outcomes and ensuring the system both protects children but also supports their families. Moving forward with recent policy innovations. The Family First Prevention Services Act pushed child welfare policy toward prevention efforts. It allowed for federal funding to support systems or services like mental health treatment, substance abuse programs, and education for parents to help keep families together and prevent placement in foster care. Another new policy was Kayden's Law. This was passed in order to help push focus on child safety in custody cases. It requires that the courts consider the evidence of domestic violence or child abuse when they are making decisions for custody. This is an effort to protect children from ongoing abuse. Now that we've discussed the child welfare system and policies surrounding the system, let's discuss the social workers that play critical roles within the system. Roles of social workers. Social workers play vital roles within the child welfare system. One key role is policy implementation, where they apply policies and programs directly in their work with families and children they serve. Social workers are responsible for upholding laws and policies while carrying out those and supporting children and families. Social workers also serve as advocates, ensuring that vulnerable individuals have access to necessary services and supports. Social workers advocate for the needs and rights of their clients and the populations that they serve. Social workers have ethical responsibilities. These responsibilities guide social workers to act in the best interests of their clients while also following professional standards. Social workers must follow professional ethics that include promoting client well-being, maintaining confidentiality, and upholding our code of ethics. Social workers advocate on all levels, from micro to macro. Social workers may recognize recurring patterns of housing instability, lack of resources, or barriers to services, and they work diligently to advocate for policy changes and systemic changes to better serve their clients. Finally, social workers help connect micro-level practice with macro-level policy, using their clients' experiences to inform and improve policies affecting larger populations. Let's discuss the strengths of the child welfare system. The child welfare system has several strengths that help support and protect vulnerable children. The system has legal safeguards that ensure cases are reviewed by courts and that both children and parents have rights within the child welfare system. The system focuses on permanency, meaning the system works towards placing children in stable, long-term homes whenever possible. Additionally, many agencies are now using trauma-informed practices to better understand how abuse and neglect impact children's development and their behaviors. Finally, collaboration among professionals such as social workers, teachers, healthcare providers, and the courts help to promote and provide comprehensive support for children and families in the child welfare system. While the system does have its strengths, it does have ongoing challenges. The child welfare system still faces several ongoing challenges, such as systemic bias and disparities that contribute to the overrepresentation of minorities and low-income families. Funding limitations strain an already overburdened system. Funding limitations affect the ability of prevention services and support for programs that help children and families. Youth who are aging out of the foster care system also face great difficulties with housing, education, and employment. Youth who are aging out of the foster care system are often left with very limited support, guidance, and resources. Additionally, the case managers or child welfare workers within this system are often overworked with high caseloads. I know this from experience. High caseloads have an effect on the level of attentiveness that workers are able to provide to the families and children that they serve. As we come to a close on this presentation, I would like to discuss future directions for child welfare. Future improvements in child welfare should focus on more prevention and family support. There is a need for increased funding for early intervention services that can help address problems before children enter the foster care system. There should be ongoing efforts to strengthen community-based programs that would give families access to resources closer to home. Ongoing efforts should continue to reduce unnecessary removals by prioritizing family preservation when it is safe. Finally, there is a need for ongoing policy reform and advocacy in order to help improve systems and address the gaps in services. In conclusion, child welfare systems are largely shaped by public policy, which determines how services are delivered and how families receive support. While the primary responsibility of the system is to ensure the safety of children, it must also work to preserve family relationships and promote stability whenever possible. Policies such as prevention-focused programs and increased community support could demonstrate progress toward a more supportive and proactive system. However, the ongoing reform and advocacy are still needed to address the systemic barriers and improve outcomes for children and families. By continuing to strengthen policies and services, we can move toward a child welfare system that not only protects children, but also supports long-term family well-being.